Imagine walking into a doctor's office feeling unwell and confused. You've been experiencing strange symptoms for weeks, maybe even months. You've seen multiple doctors, but no one seems to have any answers. The uncertainty grows, and so does your frustration. Each appointment feels like a dead end, and you start to wonder if anyone will ever figure out what's wrong. Now, imagine a new kind of doctor sitting across from you. Not a person, but an artificial intelligence, or AI, developed by Microsoft. This isn't science fiction, it's happening right now. This AI, called Outdiagnoses, was recently put to the test. It went head-to-head with some of the world's most experienced doctors, tackling some of the toughest, most baffling medical cases out there. The results? Nothing short of astonishing. Outdiagnoses didn't just keep up, it outperformed seasoned physicians by a huge margin, solving cases that had stumped experts for years. This isn't your average symptom checker or online health tool. Outdiagnoses is designed to think deeply, reason through complex information, and even debate with itself to reach the most accurate diagnosis possible. It's like having a supercomputer dedicated to solving medical mysteries. The idea that a machine could outdiagnose doctors with decades of experience is a true game changer. It challenges everything we thought we knew about the limits of technology in medicine. Microsoft's AI claims to diagnose rare, complicated diseases, cases that often go undetected or misdiagnosed for years, more accurately than even the best human doctors. These aren't simple everyday illnesses. These are the medical puzzles that leave even top specialists scratching their heads, searching for answers that never seem to come. The study's results have sent shockwaves through both the tech and medical communities. People are asking, what does this mean for the future of healthcare? Are we on the brink of a new era? Could this be the beginning of a revolution in healthcare, one that makes diagnosis more accurate, care more accessible, and treatment more affordable for everyone, no matter where they live? But before we get too excited, let's take a closer look at how this groundbreaking AI actually works. How does it think? How does it learn? Let's dive in and explore the technology behind the headlines. So, how does this AI actually work behind the scenes? What makes it so different from traditional diagnostic tools? It's not just a matter of matching symptoms to diseases in a database like older systems might do. Instead, the system uses a sophisticated chain-of-debate process which is inspired by how real medical teams tackle complex cases together. The AI creates several virtual agents. Imagine them as a panel of digital specialists, each with their own area of expertise and perspective. Each agent independently analyzes the patient's symptoms, medical history, and test results, drawing on vast medical knowledge and recent research, then proposes its own diagnosis. The agents then engage in a structured debate, challenging each other's logic, questioning assumptions, and scrutinizing the evidence behind every suggestion. For example, one agent might argue for a rare infection based on subtle lab results, while another considers a genetic disorder, each defending their reasoning with data and medical literature. They point out flaws in each other's arguments, suggest gathering more data, and continuously refine their positions as new information emerges. This ongoing debate is crucial. It prevents the AI from jumping to conclusions or settling on the first plausible answer, a common pitfall in both human and machine diagnosis. After several rounds of back and forth, a moderator agent steps in. This digital overseer reviews the entire discussion, weighs the strengths of each argument, and synthesizes the best insights from all the agents. The end result is a comprehensive diagnostic report. It doesn't just give an answer, it explains the reasoning, the evidence considered, and even the uncertainties, making the process transparent. This mirrors the best aspects of human collaboration. Multiple experts working together, only the AI can do it much faster, more thoroughly, and without fatigue or bias. The AI can explore a vast range of possibilities, including rare or complex conditions that a human team might overlook, thanks to its ability to process enormous amounts of data in seconds. It's a revolutionary way of thinking about medical problem solving, combining the strengths of collective intelligence with the speed and precision of advanced technology. The entire process is transparent, logical, and meticulously designed to minimize errors, ensuring that every step is backed by solid reasoning and evidence. That's the secret behind the AI doctor's impressive results. An intelligent, collaborative, and ever-evolving approach to diagnosis that's changing the future of medicine. Here's where things get really interesting. The results of this groundbreaking comparison between artificial intelligence and human expertise. The AI system was put to the test using some of the most difficult cases ever published in the New England Journal of Medicine. Cases so complex that they often leave even the world's top doctors scratching their heads, searching for answers. In these high-stakes scenarios, the AI achieved an impressive 80% diagnostic accuracy. In contrast, human doctors working entirely on their own managed to solve only about 20% of the cases correctly. That's a massive difference, 4 times better performance from the AI, at least in this controlled setting. The secret to the AI's success? Its ability to systematically debate, analyze, and cross-reference vast amounts of medical data, making it far more effective at untangling these complex medical puzzles than any single human could be. But there's a catch. During the study, doctors weren't allowed to use the internet, medical databases, or even consult with colleagues. They had to rely solely on their own memory and experience, which isn't how medicine works in real life. So while the numbers are dramatic and headline-grabbing, they don't mean that AI is always better than your doctor in every situation. In reality, doctors collaborate, research, and use technology to help them make decisions. Still, these results highlight the AI's remarkable power to connect subtle dots, recognize patterns, and avoid the kinds of human bias or oversight that can sometimes lead to missed diagnoses. Unlike humans, AI doesn't get tired, distracted, or overwhelmed. It can process enormous amounts of medical knowledge and patient data in seconds, tirelessly reviewing every detail. This study offers a glimpse into a future where AI could serve as a brilliant diagnostic assistant, working alongside doctors to improve patient care and catch things that even the sharpest human minds might miss. It's not about replacing doctors, but about enhancing their abilities, helping them spot rare conditions, double-check diagnoses, and ultimately provide better outcomes for patients. The potential for this technology is truly huge. But as with any new technology, there are important caveats and limitations to consider before we fully embrace AI in medicine. The benefits of this AI could be enormous. First, accuracy-reducing diagnostic errors could save lives and prevent harmful treatments. Imagine an AI assistant offering second opinions or suggesting overlooked possibilities. Next, cost diagnosis is expensive and time-consuming. AI could streamline the process, suggesting the most relevant tests and avoiding unnecessary ones. This means more efficient, affordable healthcare. Accessibility is another game changer. In areas with few specialists, AI could bring expert-level support to any clinic, anywhere. It could help bridge the gap between urban hospitals and rural clinics. And speed matters. AI can analyze data and suggest diagnoses in seconds, not weeks. Early, accurate diagnosis can mean the difference between recovery and decline. AI could help doctors act faster, improving outcomes. The promise better care for more people at lower cost. But there are challenges to overcome. As exciting as this is, we need to be realistic. This AI is still a research project, not ready for hospitals tomorrow. The study was controlled. Real-world medicine is messier and more collaborative. Doctors usually consult colleagues and use every tool available, unlike in the study. A fairer test would compare the AI to a team of doctors, not individuals. Another issue: data bias. If the AI is trained mostly on one demographic, it may misdiagnose others. Ensuring diverse, representative data is critical. The AI can't do physical exams or pick up on subtle cues in a patient's story. Medicine is more than data. It's judgment, intuition, and understanding people. The AI is a powerful tool, but it's not a complete doctor. We need rigorous testing, validation, and safeguards before using it in real life. For now, it's a promising assistant, not a replacement. There's one thing AI can't replicate: empathy. When you're sick, you need more than a diagnosis, you need reassurance and understanding. A good doctor listens, explains, and comforts. AI can mimic caring words, but it doesn't feel or truly understand. Imagine getting life-changing news from a computer screen. No compassion, no human touch. Trust is the foundation of healthcare. Can we trust a machine with our most personal information? If the AI makes a mistake, who's responsible? These are big ethical questions we haven't solved. Without trust, even the smartest AI is useless. Patients may hesitate to share or follow AI advice. The human touch is irreplaceable. The future will depend on balancing AI's power with genuine human care. AI is already part of your healthcare journey, even if you don't notice. Symptom checkers online use basic AI to suggest possible conditions. Hospitals use AI to read X-rays and scans, sometimes spotting things human eyes miss. But AI doesn't replace radiologists, it acts as a second set of eyes. AI is also used to predict health risks, like identifying patients at risk for sepsis. This proactive approach can save lives by catching problems early. The integration of AI into healthcare is already underway. Microsoft's AI is the next step, a system that can reason and handle complex cases. Lessons from today's simple tools are paving the way for more powerful, responsible AI. The future is coming fast. Here's the big question: would you trust an AI with your health? If you had a mysterious illness, would you choose a human specialist or an AI with a strong track record? The logical choice might be the AI. If it's more accurate, why not use it? We trust technology in planes and banks, why not medicine? But there's an emotional pull toward human connection and care. What if the AI makes a mistake? Who's accountable? Building trust in medical AI will take time, transparency, and oversight. The best system may be one where AI recommends, but humans decide. Combining machine intelligence with human wisdom is likely the safest path. The future of diagnosis is partnership, not replacement. The future of medicine isn't robots replacing doctors, it's partnership. AI will be the most powerful tool in a doctor's kit, not a substitute. Doctors will use AI to analyze data while focusing on communication, trust, and ethical decisions. AI can democratize expertise, bringing world-class knowledge to any clinic anywhere. It can accelerate research and help discover new treatments. But we must address bias, privacy, and regulation. Trust and thoughtful integration are key. The Microsoft AI study marks a turning point, a new era in medicine. The future is not man versus machine, but collaboration. And that's something to be excited about.